Dr. Cassie from NABC's Vetfolio and the host of Vet2Vet. So in general practice, we see many of our patients for annual exams, and this is our big chance to catch all kinds of different things: chronic conditions, allergies, weight gain, osteoarthritis, weight loss. The list goes on. And it's a big chance to help talk to owners about how something like diet can help with these conditions and help improve quality of life. Joining us today is Dr. Lindsey Bullen. She's a board-certified veterinary nutritionist. And Dr. Bullen is particularly interested in clinical nutrition application, specifically critical care, multi-disease state, and assisted feeding. And that multi-disease state is something we're going to be covering here today. So, Dr. Bullen, always a joy to talk to you. Thank you for joining me.
Thank you so much for having me, Dr. Cassie. As always, it is a pleasure and a privilege to be here. I love every opportunity I have to discuss nutrition and pet wellness with you.
Absolutely. Absolutely. And I always learn something when we talk, so I'm really excited to jump into it. Well, let's start with how we find many of these conditions, and that's on the annual exam. And for me, history and physical exam are so important in determining an individual patient's needs. And of course, we think of nutrition as the fifth vital assessment. So can you talk to us about the importance of addressing nutrition as part of the annual exam?
So I'm so glad you asked that question. And obviously, I'm a board certified nutritionist, so nutrition is my jam. But what a lot of people didn't realize is that nutrition has been the fifth vital assessment for almost 15 years. That's a long, long time. And still, I will look at records and note that there's no dietary history or nothing mentioned, either by the pet parent or potentially by the veterinary professional. And so when we think about nutrition application, what the goal is to offer preventative medicine and to potentially treat diseases, right? So when we think about when they come in, that's a wonderful opportunity to evaluate what the pet is eating, obviously, because there's a saying, right? You are what you eat. And if you eat a diet that is incomplete, which means it doesn't have all of the essential nutrients, or unbalanced, which means that if you have the essential nutrients, they might not be in the right concentrations and proportions, that pet is not necessarily set up to thrive. When they come in, it's a great opportunity to say, hey, what are you eating? And it can't just be the purple or the blue bag. There's way too many different bags of that color in the pet store. Instead, we need to know the manufacturer, the brand, the flavor, the form. And we also need to know the quantity fed. And it doesn't just stop there, rather. You have to also inquire what treats, what other, human foods are fed. So for example, if a beautifully body conditioned dog walks in, that's a great opportunity to give high fives to the client, kudos, and say, hey, the calories that your pet is getting is spot on. It's perfect. So what are you feeding? And if we find out that that dog is getting a half a bag of Oreos every day, wonderful education opportunity to remind pet parents that chocolate's not cool in dogs. But B, another wonderful education opportunity to say, hey, their diet is incomplete and unbalanced and might potentially negatively impact the longevity and the quality of their life. So let's try to change that up. Let's put them on something that is complete and balanced and will help their pet thrive. And heaven forbid, they're like my cat and we diagnose 3 diseases in one go. We can say, hey, this is a great opportunity to augment the already excellent medical and surgical care that the veterinary professionals provide by applying a complete and balanced diet that is appropriate for that disease state. So really, really important to include the dietary history as part of the medical history every single time that pet comes in.
And, when I'm thinking of patients in primary care, some of the ways that I approach things are like planting the seed, I call it. And sometimes just asking that question, what is your pet feeding? If you don't get anywhere, maybe you're not a fan of their choices of what they're feeding their dog, and maybe you don't get anywhere right in that conversation, but just asking the question, noting it in the medical record, letting them know that that's important information can do exactly that. It lets them know that it's important information and that we need to continue to communicate about that, because making adjustments in nutrition can really have a big impact on their dog's lifespan and, like you said, quality of life.
Absolutely. And I'm so glad that you brought that up, because if we don't say anything, that is a silent endorsement that what they're doing is okay. And maybe it is okay. But everybody likes a little bit of positive reinforcement. So it's a wonderful opportunity, if it's a good diet for that particular pet, to say, hey, you are an excellent pet parent. You're doing a great job. They feel good about it. And then the next time they come in, if anything changes, they know that you're on your game, right? They know that you've asked about it all of these years or all of these months. So it's important. And they're typically more likely to listen to the professional because you've brought it up every time and it's not just a one-off.
One of the big things we want to talk about here is dietary therapy for comorbidities. And, in our patients that are aging, of course, we're going to see more and more comorbidities. What are some of the top comorbidities in dogs and cats that you come across in nutrition practice?
Yeah, that's an amazing question. So because I work in a specialty clinic, and we provide tertiary care, most of the clients and the patients that come to see me have a lot of problems. And as you mentioned during the introduction, the more problems, the better for me. So multi-disease state is something I'm very passionate about and something I love working with. So what I would tell you is, for each of the different species, I see a couple different things. For dogs, the majority of the patients that I see are overweight to obese. So you can add that to any of the problems that we're about to talk about. But there's also a lot of dietary hypersensitivities or food allergies. So being overweight and having food allergies is a big one that I see. Joint problems and being overweight is a big problem that I see. And then urinary issues are actually a problem. And then, of course, being overweight. When we think about the feline species, of course, obesity is also a problem. There's an obesity epidemic, unfortunately. But one of the more common things that I see that goes along with obesity is constipation. Unfortunately, when you have a lot of extra adipose or fat tissue in the belly, it can kind of get in the way of being able to defecate normally. Other things that I see oftentimes, especially in my geriatric feline patients, is chronic kidney disease and potentially a primary enteropathy or GI disease. And the question is it IBD? Is it lymphoma? Sometimes you don't know, but that combination I see all the time. And then the other thing that I see all the time in kitty cats is feline lower urinary tract disorder diseases, because we've taken these amazing carnivore predator desert animals from the outside and we've cooped them up in our little houses and we said, hey, enjoy life. I'm busy, have fun. And a lot of them are stressed and a lot of them get fluted. So
Oh, isn't that the truth? And that I would say echoes completely what I see in practice. And yes, I spend a lot of time talking about feline nutrition and how to feed a house cat, essentially, to help lower their stress, mirror some of their normal behaviors, and stop them from peeing on the bed every day.
That would be ideal.
Yes, absolutely. So let's break some of these out individually, because they're all important. And like you said, they don't happen in a vacuum. They oftentimes occur together. Let's start with urinary. This is one that is near and dear to my heart. I just yesterday, I've been working up a patient with plaquuria. She's going out a bunch of times a day and straining to urinate. And it turns out she has a bladder full of rocks. So we are going to get those taken care of. But when we're talking about crystals, stones, fluted, these types of things in our patients, what should we be focusing on nutrition-wise?
Yeah, so the first and most important thing is, if you can identify the type of crystal or stone, that is going to help target nutritional therapy. So I had a case yesterday, and you never know as a tertiary, clinician what was said, but they seemed surprised by the fact that the stones they were attempting to dissolve might not actually dissolve. So it's really important, if you can, to try to take a look at the information at hand and see if it can give us any clues as to what these stones are. So specifically, the most common urinary stone types in both dogs and cats are going to be your calcium oxalates, which preferentially form in a more acidic urinary environment, and struvite stones or ammonium magnesium phosphate, which preferentially form in a more alkaline urine. Now, the good thing is that the major reputable manufacturers, such as Royal Canin, have done an amazing job with research. And so the diets that they've created actually cover both. The majority of them do. And so there's a lot of times where the client is reluctant to take their dog or cat to surgery immediately and says, hey, what diet can I feed that will potentially reduce the risk of more calcium oxalates or might dissolve the struvite, because they can undergo dissolution. And there's many diets out there that can accomplish that. So when it comes to diet, the biggest thing that I like to do with my clients is set realistic expectations. So for example, this patient yesterday, she was convinced it was struvite. There was no sign of a urinary tract infection. The urine was acidic. There weren't any crystals. So if they were present, that would have been helpful to say, oh, look, there's crystals in here. But I said, look, it could be struvite. It could actually be a stone we're not talking about because I don't have the stone for analysis. But based on the information, it seems more likely to be calcium oxalates. It's a tiny little floofy dog breed. They tend to get it. So realistic expectations, yes, they should feed a diet that is designed for urinary disease because it can help slow down the rate of formation of calcium oxalates and reduce the risk. But I will never promise that it will prevent it because every pet is a unique individual. When it comes to struvite, same thing. If we are attempting dissolution, really important to share with them why they form. So in dogs, they tend to be associated with a urinary tract infection. In kitty cats that are young, they tend to be sterile. Both dogs and cats can, get the opposite one, but again, setting that expectation that, hey, we can attempt dissolution, but if it's associated with a urinary tract infection, you've got to keep them on these antibiotics. You have to have rechecks. And again, the diets are designed to help reduce the risk, but with clear expectations, we should never promise because we don't know how compliant those clients are going to get. And that's the last point for diet and stones. There really needs to be 100% compliance to make them work.
That's a really good point. I have absolutely had to have that conversation. And it's another one of those conversations that can evolve over years and unfortunately sometimes multiple surgeries where it's, no, but you really have to feed only this diet. I know it's frustrating. I know it's difficult. Is there anything that you tell people maybe to make that easier for them to feed one single diet?
Yeah, absolutely. So one of the things that I like to share with them, because most people are financially cognizant, is, hey, feeding this diet is an investment for your pet's health, and it's probably going to save you a couple $1,000s of cystotomy surgeries in the future. So if they are financially driven, that tends to be like, oh, yep, we're going to follow your instructions because I don't want to do any more cystotomies. And the other thing, of course, these pet parents care about their pet. And so the thought of them having to undergo multiple surgeries can be devastating for them. The other thing is that dogs and cats don't necessarily have to have treats. That's something that we as pet parents choose to do to show our love. But there's also treats available that are designed to help with urinary issues. So if treats are important, we can say, hey, you're going to feed this one type of diet from this manufacturer, but look, there's a treat that goes along with it. For me, I am willing to compromise and they're willing to compromise so that we can try to ensure this pet gets the care that it deserves.
Absolutely. Absolutely. Meeting in the middle. The other one I want to talk about before we move on to another condition that requires very strict feeding is fluted in cats. So certainly cats also, we can see crystals and stones, but so often we're seeing this lower urinary tract disease that is mimicking what we would see with crystals or stones.
So in regards to fluted, so again, fluted is feline lower urinary tract disease or disorders, and it encompasses a wide array of different types of diseases. So it can be anything from, neoplasia or cancer to urinary stones to urethral plugs to feline idiopathic cystitis to an actual UTI. So this is going to be really important, especially during those annual exams or potentially sick exams, to get that history to try to figure out, is it upper or is it lower or is it both? Is it associated with stress? Is it associated with urinary tract infection? What diagnostics do we have? So just like we talked about in terms of treatment of urinary stones with dogs, which is applicable to urinary stones in cats, it's really important to have that information so we can target therapy. Now, as I mentioned before, cats are wonderful, amazing creatures, but they are their own thing and they are always stressed out. I'm like, what do you have to be stressed out about? I've given you this beautiful, safe house. You have all the food and water that you could need. I play with you. You've got all these things. And they're like, and I'm going to pee on your floor. And so there's always a stress component. So one of the things that I absolutely love about specifically the Royal Canin product, they have a tri-function. It's not even a multi-function managing two diseases. It's a tri-function. And it manages the trifecta. It manages the fat cat. So most of these cats that have fluted are overweight to obese. And being overweight to obese as a cat absolutely significantly and negatively impacts their urinary health. Many studies have shown that you have increased incidence of stone formation, urinary issues, fluid, or FIC, all of those things. The trifunction also includes calm. So these guys are stressed out. So let's give them some extra help in the form of alpha-casozepine and L-tryptophan. Let's calm their little cute pants down so they can really relax and enjoy life in our house, because that's where they're honestly the safest. And then obviously that urinary component, so the urinary SO part. So it's going to help optimize urinary health. If there are crystals forming or stones present, again, if it's calcium oxalates, which cannot be dissolved, it will help slow and reduce the rate of formation. If they are struvite, which can be dissolved, it can help with slow dissolution and or help reduce the risk of formation as well. So that trifunction is absolutely my favorite for fluted cats, because all of my fluted cats happen to be overweight. And even if they don't look stressed, I'm like, I know you're stressed too. So yeah.
Absolutely. Absolutely. Always have to address that emotional component.
Always have to.
So on to another condition that also requires, really you have to pretty much 100% feed this diet. What about food allergies? And as we mentioned, many of our patients, no matter what the comorbidity is that we're treating, are often overweight. So what about our overweight and food allergic patients?
Yeah, that's a really good one. So one of the things that I think is important for everyone to remember is that true food allergies and hypersensitivities are not that common. It is actually quite a rare disease. But when it happens to you, it's like, it's all you think about. So my old cat who passed away a couple months ago, she had dietary hypersensitivities. She had inflammatory bowel disease, among a million other things that a geriatric cat has. My dog that I have is a 6-year-old, 70-pound boxer, ridiculous dog, and she has food allergies, and hers manifests as atopic dermatitis. She also has environmental issues, so she's got that going for her. But she also has inflammatory bowel disease. And so I know, right? The only thing she's got going for her, she is not overweight because she's my dog. So there's that. But in terms of managing dietary hypersensitivities, once you're pretty sure that a pet or a patient has them, it's important, again, this communication aspect and setting up realistic expectations with the pet parent. It takes diet trials. That is the gold standard. So what one has to do is get a complete dietary history. There's that dietary history again, and figure out all of the protein exposures that pet has had to the best of your ability. Now, if they're geriatric, pet parent probably doesn't remember what they fed 12 years ago, but again, to the best of their ability. Once we have that information, the easiest and best thing to do is just eliminate everything they've ever been exposed to, again, to the best of your ability. And if they so desire, after an 8 to 12 week feeding trial where they exclusively feed that protein source, that diet, then we can potentially challenge them and do a reintroduction. Now, truthfully, most of my pet parents are like, nope, they're good. I do not want to see diarrhea or vomiting anymore. I don't care what they're allergic to, which is kind of my MO for my Heidi. I'm pretty sure she's poultry intolerant. She's probably other things intolerant, but I don't actually care because she's on the Royal Canin hydrolyzed PS. And that's the only diet I found that works for her. So that's very, very vitally important once you find something to stick with it. Now, when it comes to being overweight to obese, suddenly this wide array of diets that we have available from, the reputable manufacturers starts to narrow and funnel down, because you don't actually want to have a pet undergo active weight loss with a well pet diet, or a diet that's designed for a well pet that is an ideal body condition. If you start to restrict calories in a diet that is not designed for weight loss, you can also unfortunately negatively impact the pet by restricting essential nutrients as well. And so there are very few diets that I will consider for a pet that has food allergies and that is also overweight to obese. If they're just mildly overweight, like most of us here, what I would probably do is consider something like the Royal Canin Selected Protein PW moderate calorie, or the Hydrolyzed HP moderate calorie. This moderate calorie can help with slight calorie reduction. But if they're more than like a body condition of 6 out of 9, I'm like, nope, you really need an active weight loss plan. And truthfully, there is really only one diet that I typically consider, and that would be the multifunction satiety plus hydrolyzed protein. So it's designed for active weight loss. It has a lower fat so that it can help mobilize that pet's endogenous or internal fat stores. It tends to be higher protein, which is an expensive, and I say metabolically expensive nutrient to have, but it also will help preserve that lean muscle mass. And then it is also calorie restricted and essential nutrient augmented, so that you can restrict those calories, but we're not actually creating nutrient deficiencies. And then that satiety part, you don't want to restrict calories in a diet that isn't designed for it because, oh my gosh, the destructive behavior will come out. So most of these diets, or this diet in particular, is going to include higher fiber that helps the pet feel fuller. Another education opportunity, if they are going from a diet that is not designed for weight loss to one that is, share with the pet parent that the poops are going to be bigger and potentially more frequent initially, and that is normal and it is fine. But nobody likes to be surprised when it comes to poop.
And I'm also thinking of like, if you restricted my calories and I didn't feel full, I would also be very destructive.
I am destructive. So I ate 300 calories for lunch yesterday and I was very, very hangry. Even my son was like, what's that word where you're mad and you're hungry? And I was like, that would be hangry. And I apologize that you know that word and that I am feeling that way at this time. Mommy will eat more calories tomorrow.
There you go. There you go. Absolutely. So it's important that we keep this in mind for our patients and we don't just willy-nilly restrict their calories. We make sure we're doing it in a healthy way. Cause we don't want to feel that way. Neither do they.
Absolutely not. I mean, we're their guardians and they can't speak for themselves. So when they destroy stuff, that's them sharing that they're not happy with the current situation.
Absolutely. Absolutely. Well, on the topic of restricting calories, you mentioned obesity and constipation in cats, and that was not that's not one that I feel like I put together when, in the initial question where you said, what are the common things that you see? So I'm really interested in the dietary management for that one. I know what I've done in the past for these patients, but really curious what I'm missing.
Yeah. So one of the important things to keep in mind with kitty cats and constipation is they can have it for several different reasons. They can have it due to dysmotility issues. They can have it because of potentially, a pelvic fracture or injury. But obesity can also compound it because, as I mentioned before, kitties, we all know they've got the little waddle, the little cat extra skin that likes to float around. But a lot of cats will actually store their fat intra-abdominally, so inside that abdominal cavity. And when you have extra fat in there, the ability to tense your abdominal muscles and compress so that you can defecate starts to decline. So you're basically just pushing against fat and the muscles are like, well, I'm doing my best. And you just hope that the poop comes out, right? The other thing that you can see sometimes is constipation associated with inflammatory bowel disease. Most of us think of inflammatory bowel disease being associated with diarrhea or soft stool, but I've definitely seen the former. It's not as common, but I've definitely seen it. And so trying to figure out why the pet continues to be constipated is going to be very important. So in the case of obesity, one of the most important things that we can do is to get that cat to lose weight. It's going to help with reducing the risk of so many other comorbidities. But B, it's going to help save money, time, pain, tears, energy, because you don't have to take your cat in to be deobstipated once a week. I've only had to do it one time with my current cat, and that was enough for her to go on daily lactulose. I was like, nope, never again. So when we think about how to treat it nutritionally, again, it depends. There is not a one size fit all for constipation, and there's not a one size fits all for any pet in terms of their nutrition. They're all unique individuals, which is why it's so lovely to have so many amazing, well-manufactured diets available. And when we think about constipation, also, it's important to decide, are they constipated or do they have obstipation and megacolon? Because I treat those two things very differently. So again, weight loss is going to be key. And we talked about that with dogs as well in terms of increasing that protein content if they can handle it. We want to drop that fat content. We want to increase that fiber. And ultimately, there does need to be calorie restriction. Now, that increased fiber is typically in the form of an insoluble fiber. So something like cellulose or hemicellulose. There might be other types of fibers in there to help support colonic health. But that tends to be what is in some of the weight loss products. So that fiber is great because it's going to help pull water from the vasculature into the colon. And that makes that dry, desiccated, constipated poop a little bit fluffier and able to absorb water and ideally easier to defecate. Now, every fiber type is going to be a little bit different. So not one size fits all. If one product doesn't work, try another product. Now, if that pet unfortunately has multiple constipation issues, needs to be deobstipated or has megacolon, now we need to go to a highly digestible, probably low fiber diet so that we are reducing the size of their feces. But when I think about, again, kitty cats, the most important thing is going to be to have that weight loss, which is where, again, the dietary history comes into play. Cat did not become overweight overnight. They're not going to lose weight overnight. 1 pound of fat loss is over 3,500 calories of a deficit. And if you do that in a cat, they will die. So instead, what we need to do is say, hey, how many calories are you feeding right now? Oh, you're feeding this tiny tortie cat 350 calories per day. Well, I don't want her to be destructive. I don't want to hurt her. I don't want her to develop hepatic lipidosis. So first, what we're going to do is transition her current diet to the new diet I choose, such as a satiety product from Royal Canin. We're going to keep the calories the same. The volume will be bigger. Poops will be bigger. And ideally, the poops will also be fluffier to ease through. Then we are slowly going to drop calories. The first week will go from 350 to 325, then 325 to 300, and so on and so forth until you eventually get to an appropriate calorie intake. By doing slow and gentle drops in calorie intake, their satiety will stay higher, their destructive behavior will stay lower, and you are less likely to cause or have the pet come into the hospital for hepatic lipidosis because we're giving their metabolism time to adjust to the drop in calories.
So I learned a lot right there as far as calorie reduction in cats. And I also really appreciated the discussion of fluffy poops because who doesn't, want their feline friend to have a fluffy poop?
Again, I think that's a really good opportunity to educate clients because they might scoop the litter box more and they'll probably go through litter a little bit faster in the beginning. So fluffy poop is desirable, but again, it's something that we should always educate the client on because nobody likes poop surprises.
This is true. This is true. And some clients will interpret if those bowel movements, if the stools are larger to say, well, my pet's not digesting this correctly and, it's a waste of food or something. So, and then that's when you get them changing without telling you and all this kind of stuff. So good to eliminate the poop surprises.
Exactly.
Well, we've touched on this a lot throughout our conversation, but, like many types of medicine, when we're talking about chronic disease states, comorbidities, this is not a one and done type of situation. We have to find the right diet that works. We have to find the right amount of calories and all these different considerations. So can we expand a little bit on client communication? We've talked a lot about important things to cover with clients. Is there anything else that you want to include to say, make sure you're talking to clients in this way when you're changing a diet, managing a comorbidity?
Yeah, absolutely. So communication is definitely, I would say, my greatest passion. I know my bio says that I love comorbidity, disease states, and critical care nutrition, which is absolutely true. But truly, education and communication is something that is just a passion of mine. And so what I have found over the years is that pet parents are very invested, very emotionally invested in what their pet is feeding, right? So in any sort of health aspect, most people don't feel like they have a lot of control. And food is one area where they can get a tiny bit of that control back. And so if they are feeding something that we as veterinary professionals disagree with, if we come at them with judgment in our eyes, in our voice, in our tone, in our nonverbals, then that can just shut the conversation down immediately because it's a direct slight at them as an individual and what they're doing, even if they know what they're doing is wrong. So what I tell my clients and what I would encourage veterinary professionals to just keep in mind is that they're coming to us for help. The fact that they walked in that door is a step in the right direction. They want to hear what we have to say. And it's what I tell my kids and my husband all the time. It's not always what you say, it's how you say it. Sometimes it's also what you say, but mostly it's how you say it, right? So yesterday, for example, when I found out that client had been feeding an incomplete and unbalanced diet that she designed herself for 10 years, my heart was just like, you know what I mean? But my face was like, oh, please tell me more because I need her to feel comfortable and safe sharing with me what's going on so I can try to help her pet. So when we're making that recommendation, we don't necessarily want to focus on all the reasons why the diet they're feeding is bad. We want to focus on the reasons why the diet we're recommending is good or preferable. So again, for that overweight dog that has urinary stones, it's important to say, hey, what you're doing apparently worked for your dog for 10 years. And clearly you care about your pet because you are spending the time, the money, and the effort to cook for them this whole time. Like, kudos to you for loving your dog that much. I don't love my dog that much. I'm just kidding. I love her to pieces, but I don't have the time to cook for her. So in a way, I've given her, a high five and a slap on the back for trying to be a good pet parent. I'm not focusing on the fact that the diet she was feeding probably almost killed the dog. So then I say, okay, but your dog now has these problems. And the best way to achieve it would be the Royal Canin multifunction, urinary plus satiety. And this is why, and then go through all the things we just said. It's designed to create an optimal urinary environment and reduce the risk of X, Y, Z. And it has more fiber to keep your pet feeling full and less fat and augmented with essential nutrients. And everything I just said is also very important to the client. I've had cases where they are doctor Googling me as I speak to them because they want the information. And so if I offer the information, I'm including them in the care of their pet, in part of the conversation. It's more of a team approach than a you do what I say approach. So, I know there's different ways of doing the same thing, but for me, I would strongly encourage veterinary professionals to listen, try to understand why the pet parent was doing what they're doing in the first place, put yourself in their shoes, and then focus on what they did well, and then focus on how we can help work together for the future. And don't forget to educate why we're doing this, because if you don't, what they're going to do is they're going to go to the pet store or they're going to ask their friend or whoever it is and say, well, my vet recommended this crazy diet from some French company and it's kind of expensive. And I don't understand why I can't just feed this diet that has a picture of a urinary bladder on it. So we really need to take that extra time to explain that, hey, that French company happens to have the most board certified nutritionists on staff, happens to have the highest quality control methods, and really invests in, research and development to ensure that the pet is thriving. And then they take these diets and they actually perform extensive trials to make sure that they're actually efficacious. And so, yeah, the diet might have a higher number on it, but it's not expensive to be expensive. That number is on there because it reflects the quality of the product that it is and the fact that it works. It's an investment. So I don't ever apologize to clients either. I'm not like, I'm sorry, my cost is expensive, the diet's expensive. I'm like, it is an investment. It's an investment to your pet's health. And my hope is that instead of investing money on multiple cystotomies and insulin injections and XYZ, we're going to invest in an optimal diet. So that is typically how I approach communication at the level of recommending a diet, but then follow-up is equally, if not more important. So I would strongly encourage having your paraprofessionals, so your nurses, your technicians, your coordinators, reach out on your behalf and just say, hey, my crazy vet recommended this product last week. How's it going? Have you bought it yet? Do you need help finding it? Did you get the prescriptions? How does Fluffy like it? Because that shows the pet parent that we are emotionally invested in the well-being of their pet and they're not just forgotten. And it's a great opportunity for them to ask questions if they have questions so that we can make them feel more comfortable with what we've recommended and to share if things aren't working. Because if they're not working, we need to reassess. So follow-up is going to be very important for this as well.
Absolutely. Tons of nuggets there that I took away and I'm going to put in my pocket here. I wish I could sometimes in these conversations just kind of like have you in my hip pocket and be like, okay, tell me all the things about nutrition, because I agree with you that communication is so important and expressing why we're making the recommendations that we do. However, putting myself in this conversation, I'm picturing this situation, this conversation, and sometimes being able to kind of explain the nuance behind why we're making the nutrition recommendations that we are, especially when, like you said, sometimes we have clients that are there Googling it as you're talking, or they come back with a huge list of questions because why did you recommend this? And what do you actually know about it? It can get a little intimidating sometimes.
Sure.
Could you offer a recommendation to general practitioners to help increase our nutrition knowledge, our confidence when we're making these recommendations?
Absolutely. So I don't know if you're aware, Dr. Cassie, but NAVC has a nutrition coach program. Oh, you knew about it. Okay.
Taken both of them.
So there are two different courses that one could take through NAVC, and yours truly did help with one of them. But it's not just for me; it's from a lot of people that are very, very experienced and knowledgeable in the ways of nutrition. So one of the things I love to share with my pet parents, because the question is, why didn't my veterinarian feel comfortable or mention this? I'm like, did you know that most veterinary schools don't have nutrition courses or a board certified nutritionist? Like, it's actually not your veterinarian's fault. But what I share with my veterinary professionals and colleagues is, hey, take control of your profession, take control of your expertise and experience, and seek out additional knowledge and information. And so, for example, the NAVSE courses are going to be great. There's a basic, there's an advanced, and every major manufacturer that's reputable, Royal Canin, Purina Hills, all of them actually have free continuing education courses available to veterinary professionals online so that they can continue to further that knowledge and start feeling comfortable with these recommendations. The other thing is that the major pet food companies, such as Royal Canin, will actually sponsor nutritionists to lecture at conferences. Royal Canin, I'm very privileged and pleased to say, is sponsoring me to speak at VMX in Western next year. And so again, these are really good opportunities for veterinary professionals to actively seek out additional nutrition knowledge and stay, up to speed. And even then, you don't have to always invest hours at a time on it. The sales representatives, of course, they're trying to sell. That is literally their job. Pet food is a business. It's okay. They are a wealth of information. The scientific services veterinarians are a wealth of information. So if there's a new product that you're interested in carrying, or even if there's old products that you don't know too much about, ask those people. They can give you all the information that you need so that you feel comfortable. And the other thing is, don't forget to use your big fat brain, right? We've got them for a reason. So even if you don't know all the ins and outs and nutrient profiles that are fortunately jammed in my brain, you can say, okay, I've got a cat that was normal and now has kidney disease. What changes with kidney disease? Okay, their ability to metabolize protein and electrolytes changes. So I might not know exactly what this diet has to offer in terms of protein levels, but what I do know is it's probably lower than maintenance, right? So that's where we can say, hey, look, your cat developed kidney disease, and the best thing that we can do is we can put them on a product that helps slow down the rate of progression. And this particular product, this, Royal Canin renal support product, is very helpful because it has reduced levels of protein. It has reduced levels of minerals that can potentially be toxic to your cat's kidneys. And wellness or over-the-counter products don't have that. And so again, it's one of those things where you might not know all the little special, tidbits and magic that these foods have to offer. But if we just think for a second how each of the diseases potentially impacts the pet, we do a pretty good job of saying what that diet should be accomplishing.
Thank you so much for that, Dr. Bullen. I feel like that was really empowering to say, we can take control of our knowledge and the things that we want to learn and know more about. There's a lot of resources out there, and, we can go in feeling empowered in these conversations and a lot of resources to learn what we don't know.
And that's such a good point, and something that I would love to share, especially to the new professionals out there. It's also okay to say, I don't know. And I think that actually shows a lot of strength. I remember when I started as a veterinarian and I'd been in school for what my husband calls forever. I graduated feeling like I knew less than when I started. I was not ready. I didn't feel competent. I was terrified. And the last thing I wanted to do was say, I don't know, because of all the investments that I'd made. But what is worse, again, is either staying silent, which is a positive silent endorsement of what a pet parent is doing, or spouting off a bunch of information that is incorrect, because backtracking is often worse than saying, I don't know. And I'm a board certified nutritionist. I do food for a living, and I still will tell pet parents, I don't know. I've never heard of that before. Let me look into it. And that's really the next thing, is saying, I don't know should be followed up with, but let me see how I can help. Even if it's a referral to a specialist, that's how you can help. I have so many cases where I'm like, I don't know what tertiary phosphate binder your dog should be on. Let me check. You know what? I don't feel comfortable with that. So I'm going to refer you to my nephrology friend. And I'm like, I did a good job today, and it's okay. I have way more respect for clients or for colleagues rather, that say, I don't know, but let me see how I can help. So I would encourage all of you out there to be comfortable with that as well.
Such good advice, and a good reminder for all of us that we need on a regular basis, that we don't have to know it all, and it's okay when we don't.
It is absolutely okay. My kids remind me of that all the time. Mom, you do not know it all.
Amen.
Like, to you, I do.
I know it. I know it. Well, Lindsey, Dr. Bullen, this is always so much fun. I love getting the opportunity to talk to you about nutrition, and I always learn so much. So thank you for being a part of this Vet2Vet and for joining me today.
Oh, Dr. Cassie, as always, such a pleasure and a privilege. And someday you and I will absolutely take over the world, one podcast, one Vet2Vet at a time. Until next time, thank you so much for a wonderful conversation.
And thank you to Royal Canin for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.